The Ministry of Health is calling out the public to make oxygen availability possible for the common mwanachi in the country, rendering it scarce during a third wave of COVID-19 pandemic. Faith Wambua reports of the serious shortage and expensive cylinders in the markets.
As the third wave of COVID-19 ravages the country, the National Union of Biomedical Engineers of Kenya, during a press briefing, has urged the government to make oxygen available to COVID-19 patients all around the country.
This is not being addressed by the government as it is, and we dare want, if it can be talked about by the government, then we can be good, because the Wanjiku there feels the heat. There is no oxygen. These people who are having money, they can get this oxygen, they can buy oxygen concentrators, and they can always get what they want at any time.
They are also calling for employment of more biomedical engineers.
Whenever there's a breakdown, they repair. They are overwhelmed. These biomedical engineers are working day and night with no rest. Yet, we have over 2,000 biomedical engineers in the country who are not employed. My urge to the government and to the Ministry of Health that they look at the biomedical engineering fraternity. Let them employ biomedical engineers.
In a quick rejoinder, Health Cabinet Secretary Mutahi Kagwe lamented of a serious shortage of the oxygen cylinders, calling on Kenyans to surrender them since it's illegal to hold them.
In addition to standardization of the plants, the ministry is also looking at the possibilities of creating a policy where we are more at home with the lease of plants, of oxygen plants, rather than the purchase of oxygen plants. We have all seen the challenges of maintenance, the requirements in terms of qualification of people who maintain these plants.
18 deaths of COVID-19 have been reported in the last 24 hours, all of them being late death reports from facility record audits that occurred on diverse dates. This now pushes our cumulative fatalities to 2,135. 902 people have tested positive to the disease from a sample size of 3,395 tested in the last 24 hours, maintaining the positivity rate at 26.6%. Total confirmed positive cases are now 131,116. Oxygen is a critical amenity for COVID-19 patients, especially now during this COVID-19 pandemic. The biomedical experts are calling on to the government to make it more available to common mwananchis and increase the number of biomedical workers to aid in this production. Faith Wambua, Switch TV.